Without too much more delay, our Premier Darrell Dexter, my leader, our Premier, Darrell.
Well, thank you very much, Brian. To Bruce's, nice to be here with you, and of course, nice to be here with all of you. And I want to thank the members of the community, the board, the staff, all of you for being here with us today for the official opening of the Collaborative Emergency Center. This is the sixth Collaborative Emergency Center that's officially opened in Nova Scotia. There are three more that we have planned across the province. Anxiously awaiting the opening is New Waterford, Muscatauga Harbour, and Lunenburg down in Fisherman's Memorial down there. They're looking forward to ensuring that those communities get the kind of service that CECs are capable of delivering. I think it's interesting because each one of the collaborative emergency centers are different depending on the community in which they're serving. So they're actually very, very responsive in the sense that they address the need that they find in the particular community in which they're located in, and that's the real strength of these organizations, of these facilities. I'm like anyone else. I spent a lot of time over many, many years involved in healthcare issues. I served on the board of the Dartmouth General Hospital and served on the board of the VON, and it's always been a great interest of mine the way in which we go about delivering services, healthcare services in our community. And we all know, and I think have experienced, some of the frustration that happens when you go to an emergency room and you're not able to get seen in what you consider to be a reasonable period of time, and whether it's you or a member of your family or just a friend of yours who's been through that kind of frustration, it really becomes part of the shared experience of the community. So what we want to do is figure out how we use the resources that we have to better be able to ensure that people get what is the real crux of Medicare, which is to ensure that people get the kind of service that they need, where and when they need it. And that's what the collaborative emergency centers are really all about. So the collaborative emergency center here, as you know, this is the official opening, but it has been operating over the last number of months since September, and I want to report to you that over those months, more than 1,100 people have come through the Collaborative Emergency Center to receive the kind of assistance that they need. And it is interesting that in the year prior to this, the emergency room had been closed for almost 1,400 hours. Since September, there have been no closures of the Collaborative Emergency Center at all. So this is, in fact, ensuring that we're delivering on the commitments that I think we have made collectively to each other. Because the reason, and I'm sure I don't have to tell you this because you see it firsthand, the way that you support your hospital, the way that you gather together to raise funds, but that was what happened originally around Medicare, was that we all just acknowledged as a society that there's some things that we can't just deal with on our own. Some things we have to deal with collectively. We have to come together as a community and provide for each other. And healthcare is one of those things that we have a kind of social contract around. And so what this does is it actually fulfills those hopes and aspirations that people have to ensure that we are in a caring society, making sure that people are getting the services that they need. In addition to the work that's already being done here, I want you to know that we have, through the very hard work, and I want you to know this constituency, this area has been very, very well served by Brian Skabar, who raises with me all the time the issues that are associated with the various institutions in whether it's healthcare or education in these communities, and we essentially work together on many of these things. So we have committed to an additional $2 million for the development and design of a new facility that will house the CEC, which is here, so that it will have its own space to operate out of, and we're looking forward to the 2014 budget, which will actually contain the construction budget itself, so that this facility will get built. In the meantime, we've allocated some additional money for some space here to give better room for the Collaborative Emergency Center to operate now. None of this could happen unless we had a community that was open to the way that Medicare is changing. That we have to have a community that's open to it. We have to have leadership among the District Health Authority. We have to have buy-in from the staff. We have to have a collective effort to make sure that we get these things done. So part of what I want to do today is to say thank you to all of you. I want to say thank you to the community. I want to say thank you to the leadership in the District Health Authority. I want to say thank you to all of the staff, the physicians, the nurses, the nurse practitioners, the paramedics, all of the healthcare professionals who are making these a reality for us. I was speaking to Tom earlier about it, and we were just chatting a little bit about what it means to extend the scope of practice of paramedics and allows them to get a level of professional satisfaction out of the work that they're doing, and allow them to have a broader scope where they're practicing in a different kind of a setting, and extends and takes advantage of the lifetime of experience that paramedics gain, often in very difficult circumstances, and being able to put that in a new site. And I think that's exciting in and of itself. Brian, the last thing I want to say is that Brian mentioned just a short time ago, and I was talking with some folks here about this earlier, that this is not just about, it is about delivering services into our community and doing all the things that I've already said, but it's also about being a leader on a national scale. Brian mentioned that Saskatchewan and the Premier of Saskatchewan, when he was here at the Council Federation meeting, said, we've seen, we intend to steal this model and bring it back to Saskatchewan. And I know that folks from here were actually in Saskatchewan. Well, in fact, I think it was the last time I was here to talk about the opening of this CEC. We're in Saskatchewan, briefing them about the model and how it worked. It went very well, and they're moving along down the road to the adoption of this model. Very soon they're going to meet with the Minister of Health from Prince Edward Island and to talk to them about this model. And I think it's great, and I hope you won't see this as in any way being partisan, but the New Democrats and before us the CCF and the original leader of our party, Tommy Douglas, was the founder of Medicare, and he believed intently about the ability of that kind of notion of the collective commonwealth, where we share the resources that we have, and in particular provide healthcare services. For me, I think about the fact that I wonder what he would think today if he were here to see Saskatchewan, the home of Medicare, learning from Nova Scotia about a new way to deliver that thing that he was so proud of. Don't you think I think that's amazing. I really do. I think it's us giving back something from which we received. So like I say, I say that in the most nonpartisan kind of way. I just think it's a nice little symmetry. I think it's wonderful that we could be here today, and on behalf of Brian and myself, to share this opening with you. I want to thank you for all of that, and I'm going to turn it back over to Brian. Thank you.
Thank you very much. Always a pleasure.